The operating room doors hit the wall so hard the sound carried 3 floors down. Dr. Raymond Voss stood at the center of the room, chest heaving, one finger leveled at the scrub nurse across the instrument table like he was passing a sentence. His voice didn't waver. It didn't shake. It cut through the antiseptic air with the clean certainty of a man who had never once been told he was wrong. "You are done," he said. "Pack your locker and get out of my hospital." Nurse Sara Merritt didn't flinch. She set down the retractor she'd been holding, pressed her hands flat against her thighs, and said nothing. She didn't argue, didn't cry, didn't beg. She just looked at him. That look made 2 of the circulating nurses step back without understanding why. 40 minutes later, 3 military vehicles, 2 black SUVs, and an armored transport with federal plates pulled into the ambulance bay of Hartwell Memorial Medical Center in Raleigh, North Carolina, and stopped there like a wall. The men who stepped out weren't police. They weren't hospital security. They wore uniforms that made the ER-charged nurse go pale when she looked out the window. They were asking for one person. They were asking for Sara. If you've made it this far, stay with me until the end. Like this story, follow my channel and drop your city in the comments. I want to see how far this one travels. Hartwell Memorial wasn't a famous hospital. It sat in the middle of Raleigh without the prestige of the university-affiliated centers downtown. Solid floors, reasonable equipment, a nursing staff that kept things running on their own competence because the administration ran on its reputation. It was the kind of place where a good nurse could disappear into the rhythm of shifts and paperwork and never be noticed for anything except whether she showed up on time. Sara Merritt had worked there for 4 years. In that time, she had become invisible in the way that only the most capable people manage, not because she failed at anything, but because she never made anyone feel threatened. She knew where every instrument was before anyone asked. She could read a surgeon's rhythm within the first 10 minutes of a case and predict what he'd need 3 steps ahead. She didn't talk much during procedures. She just worked. The other nurses in the surgical unit had a quiet respect for her that they'd never put into words because she'd never asked them to. Dina Okafor, who'd worked trauma for 11 years and could hold her own against any attending in the building, once said that she'd never seen Sara drop anything, miss a count, or get rattled. Not once, Dina told someone. Not even during the bus accident in March. When someone asked what was special about that case, Dina just said, "We lost the lights halfway through a chest open. For about 45 seconds, nobody could see anything." She paused. Sara's hands never moved. What nobody at Hartwell Memorial knew, not Dina, not the OR charge nurse, not the hospital director, was that Sara Merritt had spent 8 years before Raleigh doing things that made a power failure during open heart surgery feel manageable by comparison. She didn't advertise it. She'd never walked into a job interview with her service record or her commendations or the particular classification rating attached to the unit she'd served in. The discharge paperwork she'd filed listed her specialty as emergency trauma medicine. The civilian license she'd earned sat in the same file with everything else. She was a nurse. She was very good at it. That was all anyone needed to know. She'd chosen the quiet on purpose. The transition from the kind of work she'd done, mobile surgical units, forward operating bases, 2 tours that never officially happened in locations that were never officially confirmed, to a scrub nurse in a mid-sized North Carolina hospital was not a step down. It was a choice. She'd watched enough men and women burn out trying to bring the intensity of that life into civilian medicine, trying to replicate the adrenaline or the clarity that came with impossible situations. She wasn't interested in that. She wanted to do her job well, go home to her apartment, and sleep without hearing aircraft. For 4 years, that's what she'd had. Then Dr. Raymond Voss rotated into Hartwell Memorial as the new chief of trauma surgery, and the quiet started developing cracks. Voss arrived in September with 3 publications and journals that the administration had framed and hung in the hallway outside his office, a reputation for aggressive surgical technique, and an absolute inability to tolerate anyone in his operating room who he didn't consider an equal, which, in his framework, meant no one. He was 47. He was from Boston originally, educated at institutions he mentioned within the first 5 minutes of any introduction. He had hands that moved fast and a voice that could fill a room without effort. He also had the particular kind of arrogance that presents itself as perfectionism. He didn't berate people because he was cruel, he told himself. He berated people because standards mattered. The nursing staff read him within a week. They rotated around his preferences, learned his cues, warned each other before difficult cases. Most of them had dealt with surgeons like him before. You managed. You kept your head down. You got through the shift. Sara had dealt with far worse. She said nothing about Voss to anyone. What she noticed, and kept to herself, was that his technique was occasionally less precise than his reputation suggested. There were moments, small ones, the kind nobody else would catch, where his hands made a decision that she would have made differently. She logged those observations in the back of her mind and didn't mention them because they were within the margin of acceptable practice and it wasn't her call to make. She was the scrub nurse. She handed him instruments. The first real collision happened 6 weeks after he arrived. It was a scheduled procedure, a laparoscopic repair that should have been clean and predictable. Voss was moving fast, the way he often did on cases he considered beneath his skill level, and Sara could see from the monitor that the angle he was working wasn't giving him the visualization he needed. She said nothing for 3 minutes, watching, confirming what she was seeing. Then she said, "Doctor, the camera angle is off-center. You might want to adjust before you proceed with the dissection." Voss paused. He looked up from the monitor and across the table at her with an expression she recognized. Not anger yet, but the precursor to it. The look of someone deciding whether the comment was worth addressing. "I didn't ask for your assessment," he said. "No, sir, I know." "Then hand me the clip applicator." She handed it to him. He continued. The dissection went fine, but it took longer than it should have, and she saw 2 of the residents exchange a glance that they thought she didn't catch. After that, Voss developed an opinion of Sara Merritt. He started with small corrections delivered in front of others. Her glove technique, her position at the table, once an extended comment about the proper way to organize an instrument tray that every other nurse in the unit knew she'd been doing correctly for years. It wasn't that any of the corrections were accurate. It was that they were consistent. He was establishing something. Dina pulled Sara aside in November and said, "He's targeting you." Sara said, "I know. You should document it." "I'm aware." Dina waited for more. Sara didn't offer any. After a moment, Dina said, "You're not scared of him." It wasn't a question. Sara recognized it as the thing Dina had been trying to name since September. "No," Sara said simply. Dina looked at her for a long moment. "Why not?" Sara thought about how to answer that honestly without saying anything she wasn't willing to say. "Because the things I'm actually scared of don't happen in this building," she said. Dina didn't ask what that meant. Some people knew when they'd hit the edge of a thing. Infatti, December brought a cold front through Raleigh that knocked the temperature into the 30s and kept emergency volume low for the first week. Then on a Thursday afternoon, a semi-truck jackknifed on I-440 and took 4 passenger vehicles with it. Hartwell Memorial received 7 of the trauma cases. 3 were critical. Sara was assigned to the primary trauma OR. Voss was running the room. The first case was a woman in her 50s with a fractured pelvis and internal bleeding that Voss managed competently. The second case was a 19-year-old named Marcus Webb. Marcus had been in the passenger seat of a compact sedan when the semi-truck hit it from the side. By the time he arrived at Hartwell Memorial, he had a hemothorax on the left side, a shattered clavicle, and a BP that the paramedics had been fighting to maintain since they'd pulled him out of the wreck. His pressure was 74 over palp when they wheeled him through the OR doors. The anesthesiologist, Dr. Keene, looked at the monitor when they got him connected and said, "We need to move." Voss moved. Sara would give him that. He didn't hesitate on emergencies. He opened the chest, got control of the obvious bleeding, and the pressure started to stabilize. For about 4 minutes, it looked like the case was going the direction it needed to. Then Marcus Webb's numbers started trending wrong again. Sara was watching the field and watching the monitor simultaneously, which she always did. She could see what Voss had addressed. She could also see, based on the pressure pattern and the rate of decline, that there was something he hadn't addressed. A second source, not where he was working. The hemothorax presentation on the left had been the obvious injury. The pattern she was reading now pointed somewhere else. She said, "Doctor, his pressure is still dropping. The rate suggests a secondary source. It might not be left-sided." Voss didn't look up. I can see the monitor. Yes, sir. I'm flagging the rate of decline. If there's a second bleed, I said I can see the monitor. His voice had an edge now that the whole room felt. Unless you have an MD behind your name that I'm not aware of, I suggest you stay in your lane. Dr. Keene glanced at the monitor, then at Sara. She could see him doing the same calculation she was doing. Sara said nothing more. She watched the field. She watched the numbers. Marcus Webb's systolic dropped to 61. Voss adjusted his approach, checked the area he'd already controlled, found nothing new. The pressure dropped to 54. He's crashing, Keene said, not with panic, just with the flat precision of someone stating a medical fact that required a response. Voss's hand stilled for 2 seconds. It was a short hesitation. Most people in the room probably didn't register it, but Sara registered it because she'd been watching for it, because she'd seen that specific stillness before in situations that were less forgiving than this one. She said, "Doctor, right side. Posterior mediastinum, the trajectory of impact from the door panel. I told you, would compress the right lateral intercostal vessels. He's bleeding from the right. You need to cross to the right chest now." The monitor alarm started. Marcus Webb's heart rate spiked, then dropped. For 1 second, nobody moved. Then Voss looked at the field, looked at the monitor, and something behind his eyes shifted into a place that wasn't pride or anger. It was something closer to uncertainty. And in an operating room, uncertainty was the most dangerous thing in the room. Sara didn't wait for him to resolve it. She moved to the right side of the field, already knowing what she'd find, her hands operating on a kind of knowledge that came from a place Hartwell Memorial couldn't have trained her. She'd seen this injury pattern in a dust-covered field station with a generator for light and nothing overhead except the sound of aircraft she wasn't allowed to talk about. She'd fixed it with fewer resources than this room had on its worst day. "I need a thoracotomy tray on the right," she said to the scrub tech. "Now." The scrub tech looked at Voss. Voss looked at Sara. The monitor alarm was continuous. "Give it to her," Voss said. His voice was very quiet. Sara worked. She didn't narrate it. She didn't explain her steps. She found the source, right lateral intercostal, exactly where she'd said, controlled the bleeding with the precision of someone who had done this in conditions that would make this OR look like a luxury. She didn't hurry. She was efficient. There is a difference. Marcus Webb's pressure started climbing at the 7-minute mark. By 11 minutes, it was at 90/60. By 16 minutes, it was stable. The room was completely silent. Dr. Keene exhaled slowly and said, "Good catch." Nobody looked at Voss. Sara stepped back, stripped her gloves, and moved to her position at the instrument table. What happened next was not something Sara had anticipated, though she probably should have. She had understood, in the moment she stepped into the field, that there would be consequences. She was a scrub nurse. She was not licensed to perform surgery in the state of North Carolina, regardless of her training or her service record or what she was actually capable of. She knew that. She had made a calculation in real time. The consequences to herself were manageable. The alternative, standing at the instrument table and watching a 19-year-old die because she'd stayed in her lane, was not something she was capable of choosing. She had made that same calculation before. The circumstances had been different. The math had been the same. What she had misjudged was the speed and the shape of Voss's response. He didn't say anything in the OR. He finished the case in silence, closed with the residents, and stripped his gloves without looking at anyone. Sara had seen men do that before. Hold everything in until they found the right room for it, and she recognized the pattern. The right room, it turned out, was the OR corridor 20 minutes later. He came out of his office and walked to where Sara was charting at the nursing station, and he stopped with his arms crossed and his voice low enough that it was deliberate, low enough that people had to lean in to hear, which meant they would. "You performed a surgical procedure without authorization," he said. Sara set her pen down. "I intervened in an emergency when the patient was crashing and a decision needed to be made. You're a scrub nurse. You handle instruments. That is the limit of your role in my operating room. The patient's pressure was in the 40s. The rate of decline, I'm not interested in your reasoning." He leaned on the counter. "You overstepped. You undermined my authority in front of the entire surgical team, and you performed an unauthorized procedure that could expose this hospital to significant liability. Sara looked at him directly. Marcus Webb is alive. That is not the point. Then what is? Something shifted behind his eyes again, Shuts. That same quality she'd seen in the OR, but harder now, settled into something that had made a decision. You're terminated, he said, effective immediately. Collect your personal belongings and leave the building. The two nurses at the station had stopped pretending to chart. Sara held his gaze for a moment. Then she nodded once, stood up, and went to the locker room. She was not surprised. She was not devastated. There was a specific kind of tiredness that settled into her chest. Not grief exactly, more like the particular weight of having made the right call and knowing you were going to carry the cost of it anyway. She had felt that before too. She was familiar with it. She took her locker key from her pocket, opened the metal door, and started removing the small accumulation of 4 years. A spare set of scrubs, a tube of hand lotion, a photograph she'd tucked into the corner of the shelf that she didn't look at now. She wrapped everything into her jacket and pressed it under one arm. She was almost to the exit when Dina came around the corner and stopped in front of her. Dina looked at the jacket bundle in Sara's arms and didn't say anything for a moment. Then, "He fired you." "Yes." "You saved that kid's life." "Yes." Dina's jaw was tight. "Sara, it's fine." "It is not fine." Dina's voice cracked slightly at the edge, controlled but not entirely. "You are the best person in this unit. Everyone knows it. And he fired you because you made him look bad." Sara shifted the bundle. "He fired me because I practiced surgery without a license. He's not entirely wrong about that part. He's wrong about all of it. You know he's wrong." "Dina." Sara's voice was quiet. "I made a choice. I knew what it might cost. I'd make it again." Dina stared at her. "That doesn't make it okay." "No," Sara agreed. "It doesn't." She stepped around Dina and pushed through the door. The parking garage was cold and gray and nearly empty at that hour. Sara walked to her car and put her things in the passenger seat and sat for a moment with her hands on the steering wheel. She didn't need to decide anything right now. She had money saved. She had options. What she needed was probably just to drive. She had just put the car into reverse when she heard it. The sound was familiar in a way that the rest of Raleigh almost certainly wasn't going to find familiar. The low, specific thrum of military-grade vehicle engines in a configuration. Not police, not fire, something larger and more deliberate. She'd grown up in that sound. She'd spent 8 years in proximity to it. She put the car back in park. She sat there for 10 seconds, then got out. She could see the ambulance bay from the upper level of the garage. 2 black Suburbans in what she identified immediately as a military transport had pulled into the hospital's emergency entrance, and the men stepping out of them were in dress uniforms, not field gear, not tactical. Dress uniforms meant this wasn't operational. This was official. She couldn't hear what they were saying from where she stood. She didn't need to. She knew, in the way that you know certain things when you've lived a certain life, that this was not a coincidence. She had thought for 4 years that she had successfully left the past in the past. She had thought the quiet was permanent. The man getting out of the lead vehicle had 4 stars on his shoulders. Sara stood in the parking garage with her jacket bundle and watched him walk through the entrance of Hartwell Memorial Medical Center, the hospital that had just fired her. And something cold moved through her that was not quite fear and not quite relief. It was something older than either. Whatever was coming, she was no longer in her car. She was already walking back toward the building. She walked back through the entrance she'd left 10 minutes ago, carrying everything she owned in a jacket bundle, and the security guard at the front desk looked at her like she was a problem he hadn't been briefed on. She didn't stop to explain herself. She moved through the lobby toward the sound of elevated voices near the ER corridor, the kind of noise that happens when authority walks into a space that isn't prepared for it. The 2 black Suburbans were still visible through the glass of the ambulance bay doors. A small knot of nurses and desk staff had gathered near the windows, not working, just watching. Sara came around the corner into the main ER corridor and stopped. The 4-star general was standing at the nurses' station with 2 aides behind him and the hospital's acting administrator, a man named Gregory Falk, who Sara recognized from one all-staff meeting and nothing else, was in front of him trying to project calm authority and failing at it. Falk was the kind of administrator who existed comfortably behind policies and org charts. Standing in front of a four-star general who clearly wanted something specific was not a situation his particular skill set had prepared him for. "Sir, I understand you're concerned about your son," Falk was saying, "but I need to confirm the patient's identity through our—" "His name is Marcus Webb," the general said. His voice was controlled in the way that military voices get controlled. Not soft, just precise. "He came in approximately 2 hours ago from the I-440 accident. Trauma surgery. I need his status, and I need the name of the nurse who was in that operating room." Sara heard that and stood completely still. The general's name was Walter Webb. She knew this not because she'd seen his face recently, but because she recognized the architecture of him. The way he stood, the economy of his movements, the particular kind of stillness that people develop when they've spent decades making decisions that cost things. She'd been briefed on General Webb 6 years ago in a context she wasn't going to think about right now in this corridor. She also understood now the full shape of what had happened today. Marcus Webb. The 19-year-old in OR2 with the right-sided intercostal bleed. Marcus Webb was Walter Webb's son. Falk was fumbling with his tablet. "I can pull up the surgical team roster, sir, but our privacy protocols require—" "I'm not asking about privacy protocols," General Webb said. "I'm asking you a direct question. Who was the nurse?" Sara stepped forward. "I was." Every head in the corridor turned. General Webb looked at her. She looked at him. He took her in. The jacket bundle under her arm, the scrubs, the fact that she was standing in the ER corridor instead of wherever nurses went after a case, and something in his expression shifted into a register she couldn't quite read. "Nurse," he started. "Sara Merritt," she said. He was quiet for a moment. Then, very carefully, "What's your status here?" It was a strange question to ask a nurse in a hospital hallway. It was the kind of question you asked someone you had some reason to believe had a status beyond the obvious one. "I was terminated this afternoon," Sara said. "About 20 minutes ago." Falk made a sound. General Webb looked at Falk, then back at Sara. "For what reason?" "Unauthorized practice of surgery," she said. "I performed a thoracic intervention on your son when his pressure dropped into the 40s and the attending surgeon had not yet identified the secondary bleed." Nobody in the corridor spoke. General Webb's face didn't move. "Is my son alive?" "Yes, sir. Last I checked, he was in recovery with stable pressure and a heart rate in the normal range." Something went through the general's eyes. It lasted less than a second, and then it was gone, sealed back behind the composure. He nodded once. "I want to speak with you privately," he said, "and I want to speak with whoever authorized your termination." Falk started to interject. General Webb turned and looked at him, and Falk went quiet. They put them in a conference room near the surgical suite. General Webb and Sara on one side of the table, Falk hovering near the door with his tablet like it was going to protect him from something, and one of the general's aides standing in the corner so still Sara almost forgot he was there. General Webb sat down. Sara sat across from him. She put the jacket bundle on the floor beside her chair and folded her hands on the table and waited. "I'm going to ask you something," he said, "and I want an honest answer." "I'll tell you what I can," she said. "What you can," he repeated. "That's an interesting way to phrase it." He looked at her steadily. "Who are you, Nurse Merritt?" "Registered nurse, scrub specialty. 4 years at Hartwell Memorial. Before that, 8 years of service that I'm not going to detail in this room." 8 years, he said. "What branch?" She held his gaze. "I'd rather not answer that in present company." He studied her for a moment, then he looked at the aide. "Wait outside." The aide left without a word. Falk made a move toward the door. "You too," General Webb said, without looking at him. Falk went. The room was quiet. The fluorescent light above them had a faint flicker that Sara had already cataloged and filed away. "Army," she said. "Special Operations Medical Support. 8 years, 2 of which are—" She paused. "Categorized." General Webb was very still. "What unit?" She told him. He didn't react the way most people would react to hearing that. He just absorbed it, the way you absorb information when it confirms something you were already beginning to suspect. "You're not in the registry," he said. "No, I separated quietly. That was part of the arrangement." "Whose arrangement?" "Mine," she said. "I asked for it. I wanted to come back and not be anybody." He was quiet for a moment. Outside the window, she could hear hospital noise, a PA announcement, rolling wheels, the distant beep of monitors, the ordinary machinery of a place where people were trying not to die. "My son coded in that operating room," General Webb said. It was the first time his voice had carried anything other than precision. Not grief, something harder than grief, something that had been sitting behind the precision all along. "The attending surgeon is on record as the primary, but 2 nurses have already told my aide what actually happened in there." Sara said nothing. "You stepped into the field," he said. "Uninvited, unasked." "Yes, sir." "And you were right about the bleed." "Yes, sir." "And they fired you for it." Dr. Voss filed the termination. "The grounds are technically correct. I did perform a surgical procedure without authorization." General Webb looked at her for a long moment. "You're not angry." It wasn't quite a question. Sara thought about how to answer honestly. "I made a choice. I'd make the same one again. Being angry about the consequences of a choice you'd make twice is a waste of time." He leaned back slightly in his chair. "That's a very particular way of thinking about it." "It's the only way I know," she said. "Sir, with respect, what is it you need from me right now? Your son is stable. That's the outcome that matters. I'm not in a position to contest the termination tonight, and I don't know that I would if I were." General Webb looked at the table for a moment. Then he looked up. "What I need," he said carefully, "is to understand exactly what happened in that operating room. Because what 2 nurses described to my aide does not match the incident report that was filed 45 minutes ago by Dr. Voss." Sara stilled. "The report Dr. Voss filed," General Webb continued, "describes a competent surgical response to a complex trauma case. It does not mention any disagreement about the source of bleeding. It does not mention your intervention. It describes the successful management of a hemothorax as if the outcome was the direct result of his decision-making." The room was very quiet. "He wrote himself back into the procedure," Sara said. "That appears to be what happened." "Yes." Sara absorbed this. It wasn't surprise, and not exactly. She had known, walking out of that OR, that Voss was going to do something with what had happened in there. She had assumed it would be the termination. She had not quite anticipated that he would also rewrite the record. "He has a problem," she said slowly. "If anyone reviews the actual operative notes, Dr. Keene was in that room. The scrub tech was in that room. The 2 circulating nurses were in that room. He can file whatever incident report he wants, but there are at least 4 people who know what actually occurred." "5, said General Webb. "My aide spoke to 4 of them in the last hour. They're all willing to provide statements." He paused. "The question is what you want to do with that." Sara looked at him. "What I want to do with it?" "You have standing here, Nurse Merritt. Possibly more than you know. If Voss falsified that incident report, that's not just an employment matter. That's a medical records issue. That's a patient safety issue. That's potentially a federal issue, depending on how his hospital privileges are structured and what insurance documentation is attached to that record." "You'd know more about federal jurisdiction than I would, sir." "I know enough," he said. "The question is still what you want." Sara looked at the wall for a moment. She thought about 4 years of quiet. She thought about the locker room and the photographs she hadn't looked at, and the parking garage and sitting in her car with her hands on the wheel, trying to decide if she should drive away. She thought about Marcus Webb, 19 years old, whose pressure she had watched drop into numbers that left very little room for error. "I want the record corrected," she said. "Whatever happened to me today, whatever Voss decides to do next, Marcus Webb's chart should reflect what actually happened in that room. Not for me, for him. For the next physician who has to treat him and needs accurate operative history." General Webb nodded slowly. "That I can arrange." "And Voss?" "Voss," General Webb said, "is going to have a very difficult few weeks." Yeah. What happened next moved faster than Sara had been prepared for, which was its own kind of irony given that she'd spent 8 years in environments where things moved very fast. General Webb stepped out of the conference room and made 2 phone calls. Sara stayed at the table. Through the window in the door, she could see Falk hovering in the corridor with the expression of a man watching something large and unstoppable move through his facility without stopping to ask his permission. The first call took 4 minutes. She couldn't hear what was said, only the cadence, short, direct, the particular rhythm of someone issuing instructions to people who were going to follow them. The second call took less than a minute. He came back into the conference room and sat down. The hospital's legal team has been notified. The state medical board will receive a formal complaint regarding the incident report by end of business tomorrow. The board's investigative unit will want statements from everyone in that OR. He paused. Dr. Voss will be notified tonight that his operative record for today's procedure is under administrative review. Sara was quiet. He'll say I performed an unauthorized procedure. He will, General Webb agreed. And that is factually true. It will be part of the investigation. The question of whether a nurse with your training background acted appropriately under emergency conditions is a complicated one. It may not resolve in your favor entirely. I know that. But the falsification of the incident report is a separate matter, and that one is considerably less complicated. Sara nodded. She was looking at the table and she was thinking, with a specific, tired clarity, about the shape that a person's life takes when they keep making certain kinds of choices. She had always known this about herself, that when it came to a moment where the right thing and the safe thing diverged, she was constitutionally incapable of choosing the safe one. She had thought for 4 years that the quiet civilian life was going to eventually smooth that out of her. It hadn't. It was apparently just who she was. "Can I see him?" she said. General Webb looked at her. "Marcus?" "Yes." He considered this. "He's out of anesthesia. He's been asking about the nurse who finished his surgery." Something moved through Sara's chest that she didn't have a clean name for. She pressed it down. "I don't need him to thank me," she said. "I just want to see that he's okay." "I know," General Webb said. "Come on, Webb." Marcus Webb was in a recovery bay with a chest tube and an IV and the particular pallor of someone who had recently been somewhere the body wasn't supposed to go and had made it back. He was 20 pounds lighter than he'd looked on the table. Or maybe it was just the hospital bed making him look smaller. He had his father's eyes, Sara noticed, the same stillness in them. He looked at her when she came in and said, "You're her." "I'm the scrub nurse, yes," Sara said. "The one who—" He started, then stopped. He was looking at her with the particular attention of a young man who had been told something that rearranged some of his assumptions. "Dad told me a little bit. On the way to the room." "You don't need to know the rest tonight," Sara said. "I kind of feel like I do." She stood at the side of his bed and looked at his monitor. Habit, not need. His numbers were fine. And then at him. He was 19. He had a semester of college behind him, and a chest tube, and a reason to be alive that had depended, a few hours ago, on her making a call she wasn't technically authorized to make. "You're going to feel terrible for about 3 days," she said. "The chest tube comes out when your lungs re-expanded. Your clavicle is going to take longer. Physical therapy starts when you're discharged." He stared at her. "That's not what I meant." "I know," she said. He was quiet for a moment, then, "Were you scared when you stepped in?" Sara thought about the honest answer to that. "No," she said. "I was busy." He looked like he was going to say something else. Then he didn't. He just looked at her for a moment with those still eyes. "Okay," he said quietly. General Webb was standing in the doorway when Sara turned to leave. He fell in to step beside her as she moved back into the corridor, and they walked for a moment without speaking, which was fine. Then he said, "He's going to want to know more. Later." "Later is a long time from now," Sara said. "He should focus on his lung first." General Webb almost smiled. It didn't quite get there. "I need to ask you something," he said, "before tonight gets complicated." "Sir?" "The unit you served in, the 2 years that are categorized." He looked at her sideways. "There's a situation developing that I'm not going to detail in this hallway, but I've been looking for someone with a very specific set of qualifications for the last 6 weeks. I wasn't expecting to find them in a surgical scrub nurse in North Carolina." Sara stopped walking. General Webb stopped beside her. "I'm not asking you to answer right now," he said. "I'm asking you to be available tomorrow morning, 9 o'clock. My people will come to you." He paused. Wherever you're going to be. Sara looked at him. I just got fired. I know. I'm not currently employed. I know that too, he said, without any inflection that suggested it was a problem. Sara stood in the corridor of Hartwell Memorial with the jacket bundle still under her arm and the particular sensation of a life she'd thought she'd closed, opening back up along a seam she'd thought was sealed. She thought about the parking garage. She thought about the engine sound she'd recognized. She thought about 8 years of a thing she'd decided she was done with. She thought about the fact that she'd been done with it for 4 years, and then today it happened anyway, as if the past had simply been waiting with more patience than she had. What's the situation? She said. General Webb was quiet for a moment. He looked down the corridor and then back at her. There are 3 people in federal custody who are going to die, he said, unless someone with a very particular skill set gets to them in the next 72 hours. The facility they're being held in is not a hospital. The people guarding them are not medical staff. And the reason they're in the condition they're in is something I can't explain to you out here. He paused. But I think you already know what I'm describing. Sara's jaw tightened. She did know what he was describing. She had been in rooms like the one he wasn't describing in enough detail. She had fixed people who weren't supposed to exist in locations that weren't supposed to be operational, in situations that were never going to be on any public record. She had told herself she was done with that. She looked at General Webb's face and saw the specific expression of a man who had run out of the kind of options he was comfortable with and had ended up here, in this corridor, asking a fired scrub nurse for something he couldn't ask anyone else for. 9 o'clock, she said. He nodded. She shifted the bundle under her arm and walked toward the exit, and behind her she heard the sound of General Webb turning back toward his son's room. And she did not let herself think too hard about any of this until she was outside and the cold air hit her face, and the night was full of the ordinary sound of Raleigh going about its evening, with no idea what was sitting in the middle of it. Her phone buzzed. Unknown number. She stopped on the sidewalk and looked at it. The text was 4 words. We know who you are. She stood on the sidewalk and read the text again. We know who you are. No signature, no follow-up. Just those 4 words sitting in the notification window of her phone, like something that had been waiting to be sent for a long time. She didn't respond. She screenshotted it, forwarded it to a number she hadn't used in 14 months, and put the phone in her pocket. Then she walked to her car, put the jacket bundle in the back seat, and sat in the driver's seat for exactly 2 minutes running through the short list of people who might have sent that message and what they meant by it. The list had 2 categories: people who meant it as information and people who meant it as a warning. The distinction mattered. She drove to her apartment. She didn't sleep much. At 7:30 in the morning, her phone rang from the same unknown number. She answered it. Nurse Merritt. The voice was male, mid-40s, flat effect. Not military, something adjacent to military. I represent a party interested in your situation. Which situation? She said. I had a complicated day. A pause that was just long enough to register. The termination. Who are you? That's not relevant right now. What's relevant is that Dr. Voss filed an amended complaint last night with the State Medical Board. In addition to the unauthorized practice claim, he's now alleging that you deliberately interfered with his surgical approach, that your intervention caused additional operative trauma, and that the outcome of the case would have been the same without your involvement. Sara was quiet. She was standing at her kitchen window with coffee she hadn't touched yet. Outside, Raleigh was doing its morning thing. Traffic, a dog being walked, a delivery truck idling. That last part is false, she said. We know that. The problem is he has a supporting statement from the anesthesiologist. Sara set down her coffee. Dr. Keene signed a statement supporting Voss. Submitted at 11:40 last night. It doesn't directly contradict what you did, but it characterizes the patient's decline as within manageable parameters at the time of the nurse's intervention, which creates ambiguity about necessity. She thought about Keene, the way he'd looked at her in the OR, the exhale after Marcus Webb's pressure came back, the 2 words he'd said, good catch. She thought about the gap between what a person knows and what a person is willing to put their name on, and that gap was not new information, but it was still unpleasant. "Who are you?" she said again, differently this time. "Someone who'd prefer Voss not succeed," the voice said. "He has a pattern, Nurse Merritt. This isn't the first time he's managed a record after a difficult case. There's a prior incident in Boston, a patient outcome that was documented in a way that protected him and cost someone else their position. The person it cost was also a woman, also in a subordinate role, also correct about what she observed." Sara was very still. "Why are you telling me this?" "Because that woman never found out she wasn't alone until it was too late to matter. We'd prefer a different outcome this time." Another pause. 9 o'clock is still on. We suggest you keep it." The call ended. Sara stood at her kitchen window for another minute. Then she got dressed, drove back toward Hartwell Memorial, and parked 2 blocks away at 840 feet. General Webb's people came to her on the sidewalk, not to the hospital, not to her apartment, which meant they'd been watching since last night and had chosen not to alarm her by making that visible. There were 2 of them, a woman in civilian clothes who introduced herself only as Reyes, and a man in a jacket who didn't introduce himself at all. They walked her to an unmarked government vehicle and drove her 12 minutes north to a federal facility that had no visible signage and a parking lot with a gate that opened on a code Reyes punched in without looking at the keypad. Inside, the building looked like an administrative office. Carpet, fluorescent lights, a reception desk with no one behind it. They took her through a door that required a badge, and a second door that required a thumbprint, and into a room where General Webb was sitting at a table with a man Sara didn't recognize, and a folder that was closed. She sat down. Reyes stayed in the room. The unnamed man did not. General Webb said, "You got the text." "Last night," she said. "And a phone call this morning. Someone tracking Voss. They mentioned a prior incident in Boston." Webb and Reyes exchanged a look that lasted less than a second. "We know about Boston," Webb said. "That's partly why this conversation is happening here instead of in a hospital conference room." He put his hand on the folder. "I'm going to show you something that is classified at a level that will require you to sign a non-disclosure agreement before I open this. I want you to understand that before you agree." "What am I agreeing to?" "That what you see in this room stays in this room regardless of what you decide afterward. And if I decide not to help, then you walk out. You continue dealing with Voss and the board through whatever legal channels are available to you, and we've never had this conversation." Sara looked at the folder. "Open it," she said. He opened it. The photographs inside were medical. She had seen images like them before, not in any hospital, not in any textbook. Field photographs, clinical but rough, the kind taken in conditions that were not designed for photography. 3 individuals. 2 men and a woman. The documentation attached listed injuries she recognized as consistent with extended physical stress, inadequate treatment of what appeared to be a perforated bowel. In one case, septic presentation in a second, and a closed head injury in the third that had gone untreated long enough to create complications that a hospital would have been managing surgically days ago. "How long?" she said. The woman, 9 days. The men, 6 and 4. "Where are they?" "A detention facility outside Kinston. It's federally operated. The medical staff on site are not equipped for what these 3 people need. The closest appropriate civilian hospital is Hartwell Memorial." He paused. "That's no longer a viable option." She looked up from the photographs. "Because of Voss. Because of the nature of the situation. These individuals cannot be treated in a civilian hospital setting without creating documentation that would compromise an active federal investigation. We need someone who can work in a non-standard environment, who has the medical capability to stabilize all 3, and who is cleared at a level that makes them suitable for access to a categorized facility." Sara looked at the woman's photograph again. The septic presentation had visible markers. She was running out of time in a way that the other 2 weren't yet. "The woman goes first," Sara said. "Agreed," Reyes said from the wall. "I need a full surgical kit, not a trauma bag. I need a portable ultrasound if you can get one to Kinston in the next 6 hours. I need a blood typing confirmation on all 3 and at minimum 2 units of packed red cells on standby. I need someone in that room who is not a guard and not a bureaucrat, someone who can follow instructions during a procedure. Reyes has surgical assist training, Webb said. Sara looked at Reyes. What level? Field medic, 8 years, 2 tours, Reyes said. That'll work, Sara said. She looked back at Webb. What's the situation with Voss while I'm doing this? Webb folded his hands on the table. The medical board received 3 additional witness statements this morning from staff who were in OR2 yesterday. The amended complaint Voss filed last night is being reviewed against those statements. He's been asked not to perform elective procedures pending the review. He has a hospital attorney. He'll fight it. He will, Webb agreed. He's also being investigated for the Boston incident now, which he doesn't know yet. The board there was never formally notified because the employee who was affected signed a settlement agreement with a non-disclosure clause. Our legal team is working on whether that clause is enforceable, given what we know about the pattern. He paused. It takes time, Nurse Merritt. These things take time. And the people in Kinston don't have time. No, he said. They don't. Sara looked at the folder for a moment. Then she closed it and pushed it back across the table. When do we leave? They drove to Kinston in 2 vehicles, Sara and Reyes in the lead car, with the medical equipment packed in 2 hard cases in the back. Reyes drove. She didn't make conversation, which Sara appreciated. The drive was just under 2 hours. Sara spent it reviewing what she knew about the 3 patients from the folder, running through procedure sequences in her head, identifying the decision points that were going to require her to make calls without imaging backup. The woman, she had a case number, not a name, and Sara didn't ask, was her primary concern. The documentation indicated a perforated bowel with 6 days of inadequate treatment. That meant peritonitis was likely already in progress. Without imaging, she was going to be working from physical exam and presentation, which she'd done before, but not in circumstances where there was any margin for error in a different direction. What's her consciousness level? Sara asked, somewhere past the halfway point. Reyes checked her phone. As of this morning, intermittently responsive. She was lucid for about 20 minutes around 0600 and then went back under. That's a bad sign for a septic patient. I know. If she's been intermittently conscious and responsive, her body is still fighting. That's something. Sara looked out the window. But 6 days is a long time. She's strong, Reyes said. Sara didn't respond to that. Strong was not a medical variable. Strong was what people said when they needed to believe something was going to work out. She understood the impulse. She had learned, a long time ago, not to let it inside her head while she was working. The facility outside Kinston was not what she'd expected, which was its own kind of useful information. She had been picturing something utilitarian and grim. What she drove into was a compound that looked from the outside like an agricultural storage facility. Low buildings, gravel lot, a perimeter fence that was sturdy without being dramatic about it. The kind of place that worked by not attracting attention. Inside, past 2 security checkpoints that Reyes navigated with badge and biometric, the utilitarian part was accurate enough. Fluorescent lights, concrete. A corridor that smelled like institutional cleaning solution, and something underneath it that Sara's nose identified without her asking it to. A man in a gray uniform met them at the inner checkpoint. He didn't introduce himself. Bay 3, he said to Reyes. The woman first, per your request. Sara carried one of the equipment cases herself. The other Reyes had. Bay 3 was a room with a cot and overhead lighting and the kind of medical equipment that suggested someone had tried to provide care here and had run into the limits of their capability about 4 days ago. An IV line, 2 empty saline bags that hadn't been replaced, a pulse ox that was still attached to the woman's finger and reading 89% 89. Sara put the case down and moved to the cot and did a rapid assessment without touching the equipment yet. Color, breathing pattern, skin presentation, the particular quality of the woman's stillness. She was breathing. Her skin had the look Sara associated with sustained infection, a grayish undertone beneath whatever her natural complexion was. The breathing was shallow and slightly faster than it should have been. Her temperature, when Sara checked it, was 39.8 Celsius. She needs an IV line that's actually running, Sara said. The bag's empty and has been for a while. She looked at Reyes. In the front left of case 2, there's a saline bag and a secondary line. Get it running while I do the rest of the assessment. Reyes moved without asking questions. which was exactly what Sara needed. The physical examination took 8 minutes. No imaging meant she was doing this by touch and by pattern recognition, and what she was feeling in the right lower quadrant confirmed what she'd feared: peritoneal signs, guarding, a rigidity that wasn't there yet in the broader abdomen but was developing. The perforation had localized, the body trying to wall it off, but the process wasn't containing it anymore. "She needs a wash," Sara said. "I can't do full repair here. What I can do is lavage the affected area, get the contamination load down, pack it, and stabilize her for transfer to a proper surgical facility within the next 24 hours. If I don't do something now, she won't make the 24 hours." Reyes looked at her over the patient's body. "Can you do it here?" Sara looked at the room. She thought about the list of things she'd done in rooms worse than this one. "Yes," she said. She worked for 2 hours and 20 minutes. It wasn't clean. It wasn't smooth. There was a point 40 minutes in where the woman's blood pressure dropped faster than the fluid rate could compensate, and Sara had to make a fast decision about vasopressors with what she had available and what she didn't. And the decision she made was the right one, but it took 4 minutes of the woman being in a pressure range that was extremely uncomfortable to watch before it started working. Reyes held things, passed things, adjusted things when asked, and asked no unnecessary questions. Sara registered somewhere in the back of her mind that Reyes was good at this in the specific way that people who have done it under pressure are good at it. Not technically perfect, but functionally reliable, which mattered more. By the end, the woman's pressure was back up, and the contamination source was controlled. She was not fixed. She needed a surgical team and a proper OR and a recovery unit. But she was stable in a way she hadn't been 2 hours ago, and stable meant she could get to those things. Sara stepped back and stripped her gloves and looked at her hands for a moment. They weren't shaking. They never shook during the work. Afterward was a different story, and she pressed them flat against her thighs until the fine tremor stopped. "You okay?" Reyes asked. "Give me a minute," Sara said. She stood in the corner of the room and breathed for 60 seconds. The patient's monitor showed numbers that were not great but were not catastrophic. Sara filed that away and moved toward the door. "Second patient," she said. Otsenk. The second case was the man with the closed head injury, a subdural hematoma that had been developing for 4 days without intervention. His GCS when Sara assessed him was 9, which was low enough to be dangerous but not so low as to indicate immediate herniation. He was responsive to voice, which was something. He couldn't tell her his name. He could tell her the word water. What Sara could do here was limited. She couldn't drill. She didn't have the equipment, and even if she had, a subdural drainage procedure in a federal detention bay with no imaging guidance was a risk calculation she wasn't willing to make, unless the alternative was watching him herniate in the next hour. She assessed him carefully, checked pupillary response, equal and reactive, which was the piece of news she needed, and determined that what he needed most was careful monitoring, position management to reduce intracranial pressure, and rapid transport to a neurosurgical facility. She documented her assessment and her recommendations with a specificity that was going to make it very difficult for anyone to ignore them. She wrote it the way she'd been taught to write in environments where documentation was the only thing that traveled when you couldn't. The third patient, the man with the bowel injury, had been treated more recently and more competently than the others, which meant his situation was critical but not immediately terminal. She managed what she could, documented the rest, and told Reyes that all 3 needed hospital-level care within 18 hours. "I'll relay that," Reyes said. "Don't relay it," Sara said. "I want General Webb to hear it directly. In those exact words, 18 hours. Reyes looked at her. Understood. They were packing the equipment back into the cases when Sara's phone buzzed. She had signal here, barely, a single bar that had been dropping in and out. She looked at the screen. It was a news alert. She had set up alerts for her own name as a professional habit years ago and had forgotten to turn them off. The alert was from a Raleigh local news site. The headline read, "Hartwell Memorial Nurse Accused of Unauthorized Surgery. Files counter-complaint against trauma chief." She hadn't filed anything. She didn't have a lawyer. She hadn't authorized anyone to. She read the article. The complaint on record was not from her directly. It was a formal patient safety report filed by an anonymous party on behalf of the patient, Marcus Webb. It cited 3 named witnesses, a detailed account of the operative sequence, and included, attached as a supporting document, a copy of Voss's amended incident report alongside the original anesthesia record, which did not match it. Someone had pulled the anesthesia record. The anesthesia record was the one document in that OR that Voss couldn't rewrite, because it was generated automatically by the monitoring system and time-stamped in real time. It showed the exact sequence, the pressure drop, the rate of decline, the critical threshold, and the timestamp of stabilization. If you laid it against Voss's incident report, the story Voss told was impossible. Sara stood in the corridor of the Kinston facility with 1 bar of signal and read this and felt something she wasn't quite ready to name settle into her chest. The voice on the phone this morning. We know who you are. Not a threat. Information. Someone had been building this before she'd even agreed to sign the NDA this morning. She looked at Reyes. Who filed the patient safety report? Reyes didn't answer immediately. The general made some calls last night after you left, she said finally. Using my name. Using the patient's name. You were cited as a witness, not a complainant. That's a legal distinction that Voss's attorney is going to argue about. Probably, Reyes said. Does it change anything? Sara looked at the phone screen. The article had 43 comments already. It had been published 11 minutes ago. It didn't change anything that mattered. What it changed was that the story was no longer contained in a hospital conference room or a medical board file. It was public. Voss had a name in a news article now, next to words like falsified report and patient safety concern and trauma chief under review. That was a different kind of exposure than an internal investigation, and it moved faster. She put the phone in her pocket and picked up the equipment case. They were halfway down the corridor toward the exit when the gray uniformed man who'd met them at the checkpoint appeared at the far end of the hall, moving faster than he had before, and Reyes stopped walking. What? Reyes said. Not a question, a prompt. We have a situation at the primary facility, he said. Somebody talked. Reyes went very still beside Sara. What kind of talked? A journalist has photographs of the exterior, not the interior. Exterior only. And they have a source claiming there are individuals in federal custody who are not receiving adequate medical care. He looked at Sara when he said the last part, and it was the look of someone who wasn't sure which direction the problem had come from. The story goes live in 2 hours unless someone provides comment. Sara looked at Reyes. Reyes looked at the man. The corridor was very quiet. Call the general, Reyes said. Already did. The man's expression didn't change. He wants the nurse on the phone, now. Sara took out her phone. The bar of signal had dropped to nothing. There's a landline in checkpoint 2, he said. She followed him down the corridor and into the checkpoint room, which was small and smelled like old coffee, and picked up the receiver of a phone that looked like it had been purchased in 2009 and never replaced. She dialed the number the man gave her. General Webb answered on the first ring. The journalist, he said, without preamble. Her name is Donna Price. She works for the national desk of a major outlet, and she has a source inside this facility who we have not yet identified. The story she's preparing is not specifically about you. It's about the 3 individuals in that building and the question of whether federal detention facilities have adequate medical protocols. He paused. But your name is in it, Sara. She registered that he'd used her first name for the first time. How? She said. Voss, he said. His attorney gave a statement to Price's outlet 2 hours ago responding to the patient safety report. In that statement, he named you, described the incident, and characterized your background as unknown and unverified. He called your intervention reckless and said the hospital had a duty to protect patients from unqualified personnel. Sara was quiet. He also said, Webb continued, that given your background is apparently in some kind of military medicine, he had concerns about your fitness for civilian practice. He used the word dangerous. The checkpoint room was very small. Sara looked at the wall. He's trying to get ahead of it, she said. If the board investigation breaks publicly, he wants the narrative to be about me before it's about him. That's exactly what he's doing, Webb said. And here's the problem. Donna Price is now asking me for comment on two connected stories: the detention facility and you. She has enough on the facility to run something damaging, regardless of what I say. But the angle that connects both stories is you. He paused. I cannot protect the investigation and protect you simultaneously if this goes public the way Price is planning. Sara understood what he was telling her. You need me to make a choice. I need you to understand the options, he said carefully. Option 1. We ask Price to hold. She won't, but we ask. The story runs, your name is in it, and Voss gets exactly what he wanted. The narrative shifted to your background before anyone's looking at his conduct. Option 2. You go on record. You tell your story, your real story, controlled, with whatever level of disclosure you're comfortable with. Voss loses the narrative advantage, but your background is no longer private. Sara stood in a federal checkpoint room in Kinston, North Carolina, 12 hours after being fired from a hospital where she had saved a 19-year-old boy's life. And she thought about 4 years of quiet. She thought about the photograph in her locker she hadn't looked at when she was packing. She thought about the woman in Bay 3 whose pressure she'd brought back from somewhere it shouldn't have returned from. She thought about Voss sitting in his office somewhere in Raleigh right now, calling her dangerous. There's a third option, she said. Webb was quiet. The anesthesia record that was attached to the patient safety report, she said. That document is time-stamped. It's automated. It cannot be altered retroactively. If Donna Price has that document, she doesn't need my background to write the story about Voss. She just needs to understand what she's looking at. A pause. You want to walk her through the anesthesia record. I want someone to walk her through it who isn't me, Sara said. Someone with credentials she'll print. A medical expert who can read that timestamp sequence and explain in plain language why the incident report Voss filed is medically impossible. She paused. Can you find that person in the next 2 hours? General Webb was silent for 4 seconds. Yes, he said. I can. Then do that, she said. And General? Yes. Voss called me dangerous, she said. When this is over, I want that word in the record. His word. Because when the board looks at everything, I want them to see exactly what kind of man uses that word for someone who just saved his patient's life. There was a pause on the line that Sara couldn't entirely interpret. Then Webb said very quietly, Understood. She hung up the phone. Reyes was standing in the doorway of the checkpoint room. She'd heard enough. She didn't say anything, just looked at Sara with an expression that was not sympathy exactly, but something adjacent to respect. Sara's phone buzzed against her leg. One bar had returned. She pulled it out. The text was from a number she recognized this time. It was the number she had forwarded the first message to, the one she hadn't used in 14 months. It was a name, just a name, and a job title, and a phone number. The name was Dr. Patricia Osei. The title was Chief of Cardiothoracic Surgery, Duke University Medical Center. And underneath it, in a second text from the same number, she was in your unit, 2009 to 2011. She'll take the call. Sara read it twice. 8 years of a life she thought she'd left. And the people from that life were still out there, scattered through the world in their civilian covers. And apparently some of them had been watching what happened at Hartwell Memorial yesterday and had decided to do something about it. She dialed the number. It rang twice. A woman's voice, controlled and precise and unmistakably the voice of someone who had learned to speak in certain environments. Merritt. Osei, Sara said. A pause. I saw the anesthesia record 20 minutes ago. Someone sent it to my secure email. I've already drafted a technical analysis. Another pause. Where do you need me? Sara closed her eyes for exactly 1 second. Raleigh, she said, and I need you there before Donna Price publishes. Dr. Patricia Osei drove from Durham in 91 minutes, which meant she'd left before Sara had finished the phone call. Sara registered that without commenting on it. People from that unit had a particular relationship with preparation. You didn't wait to be asked twice, and you didn't wait to have all the information before you started moving. Osei had seen the anesthesia record, understood what it meant, drafted her analysis, and gotten in her car. That was the math. They met in a parking lot 3 blocks from Hartwell Memorial because the hospital itself was no longer neutral ground, and both of them understood that without saying it. Osei was 41, compact, wearing a coat that said she'd come from a hospital environment and hadn't stopped to change. She had a leather folio under one arm and the specific expression of someone who had already decided what they were going to do and was now in execution mode. She looked at Sara the way people look at someone they haven't seen in years but recognize immediately. Not with sentiment, just with the quick recalibration of matching memory to present reality. "You look tired," Osei said. "I've been up since 3, Sara said. "Thank you for coming." "Don't," Osei held up a hand. "Don't do the gratitude thing. I read what he filed, the amended complaint, the statement to the press, all of it." She opened the folio. "I want to walk you through what I sent to Donna Price." They stood in the parking lot in the November cold, and Osei walked her through it in 12 minutes. The anesthesia record annotated with timestamps, a technical explanation of what the monitor data showed about the patient's decline trajectory, and a medical opinion stating plainly that the intervention Sara had performed was not only appropriate given the timeline, but was, in Osei's professional assessment, the only intervention that would have produced the outcome the patient experienced. "That last part," Sara said. "You're comfortable putting your name on that?" "I already did," Osei said. "It went to Price 40 minutes ago. My credentials, my analysis, my name." She closed the folio. "She's publishing in an hour. The piece has 2 sections. The first is the detention facility. She has enough on that without us. The second is about Voss. The anesthesia record is Exhibit A. My analysis is Exhibit B. And a statement from one of the circulating nurses, a woman named Dina Okafor, is Exhibit C." Sara was quiet for a moment. "Dina gave a statement. On the record, full name. She contacted Price directly, apparently, which is how the timing worked out." Osei paused. "She said, and I'm quoting from what Price read me, 'I have worked in surgical nursing for 11 years, and I have never seen a more competent emergency intervention. What Dr. Voss filed is not a description of what I witnessed. It is a description of what he wished had happened.'" Sara looked at the ground for a moment. She pressed her back teeth together once, which was something she did when she needed to hold something in that didn't belong in this particular moment. "Okay," she said. "What does Voss know right now?" His attorney received a call from Price's editor requesting comment at 8:15 this morning. He declined to comment on the anesthesia record directly. He issued a statement through the attorney saying he stood by his incident report and that the hospital's internal processes should be allowed to proceed without media interference. Osei's expression didn't shift, which is a very different posture than the statement he gave yesterday calling you dangerous. "He read the anesthesia record," Sara said. "He read it, or his attorney did. Either way, he knows the timestamp problem." Osei looked at her steadily. "He knows the story he filed is contradicted by a document he cannot alter. The question now is whether he believes he can weather it." Sara thought about Voss, the particular architecture of his arrogance, the way it had never been about believing he was infallible, so much as believing that the people beneath him lacked the standing to challenge him. That was a different kind of confidence. It was the kind that held up fine until the people beneath him found standing they weren't supposed to have. "He'll try to make it about my license," Sara said. "It's the only ground he has left. Even if the falsification case collapses his position at Hartwell, the unauthorized practice question is still real." "It is," Osei agreed. "And that's the part that concerns me. Not legally. The emergency doctrine gives you significant cover given the timeline, but professionally, the board has to address it." "I know. Your service record would help, significantly." Sara looked at her. Osei looked back. "I'm not telling you what to do. I'm telling you what the math looks like." Sara didn't answer immediately. She thought about the arrangement she'd made 8 years ago when she'd separated. The quiet, the absence, the deliberate erasure. She'd asked for it because she'd needed it. The question was whether she still needed it the same way she had then, or whether 4 years of civilian life had changed the calculation without her noticing. "Let me think about it," Sara said. "You have about 50 minutes, Osei said. The article published at 11:17. Sara read it on her phone sitting in her car. It was long. The kind of piece that a journalist spends weeks building and then releases all at once. The detention facility section came first, sourced and documented, careful about what it named and what it implied. Then came the Hartwell Memorial section, and it was careful too, but in a different way. It didn't call Voss a liar. It laid the anesthesia record and his incident report side by side and let the timestamps do the work. It quoted Osei's analysis in full. It quoted Dina Okafor. It quoted 3 additional medical professionals who had reviewed the record without knowing any of the parties involved and had reached the same conclusion. The patient's documented decline and stabilization were inconsistent with the sequence Voss had described. Sara's name was in the article. Not prominently, cert. She was described as the scrub nurse who had performed the intervention, a former military medical specialist whose specific service background was not disclosed. The word former and the word military were there. That was all. Someone had made a decision about what to include and what to withhold, and Sara suspected it had involved a phone call she hadn't been part of. The article's final paragraph was about Marcus Webb. Not by name, he was the 19-year-old patient whose outcome is documented in the anesthesia record. The paragraph said simply that he was alive and recovering. Sara put her phone down and looked through the windshield at the parking lot. A woman was walking to her car with a coffee cup and a phone to her ear, not paying attention to where she was going. An ordinary morning. Her phone rang. It was General Webb. "It's out," he said. "I know. I read it." Voss's attorney called the hospital board chair at 11:20, 3 minutes after publication. A pause. He's asking for an emergency closed session to address, quote, false and defamatory statements published without due process. He's going to claim the article is the problem, Sara said, not the report. That's the move, yes. The board chair called me at 11:25. Another pause. The board is meeting this afternoon. They want you there. Sara was quiet. Not as a subject, Webb said. As a witness. There's a distinction, and they've been very specific about it. The subject of the afternoon session is the incident report and whether it constitutes a falsification of medical records. You witnessed the events the report describes. They want your account. Voss will be there. With his attorney, yes. Sara looked at the coffee cup woman who had made it to her car and was now sitting in it and still talking on her phone. What time? She said. 3 o'clock, Webb said. Hospital Administration Conference Room, Floor 7. I'll have Reyes with you. I know you don't need her. I'm sending her anyway. A brief pause that was not quite a hesitation. Sara, the board chair is named Miriam Tate. She's been chair for 6 years. She is not a person who enjoys being put in a difficult position by people who work at her hospital. Voss has put her in a difficult position. That is relevant context. Understood, Sara said. She hung up and sat in the car for another minute. Then she called Osei. I need to tell you something, she said when Osei answered. About my background, before 3 o'clock. Tell me, Osei said. So Sara told her. Not everything. Not the locations, not the unit designation, not the 2 years that were still categorized, but the shape of it. 8 years, combat surgical environments, the specific kind of training and experience that civilian medicine didn't have a credential framework for because it had never needed one. The things she'd done that an OR scrub nurse wasn't supposed to be able to do, and why she could do them, and why she'd spent 4 years not telling anyone. Osei listened without interrupting. When Sara finished, there was a short silence. You should have told the board in your initial nursing application, Osei said. I know. They're going to have a problem with that. I know that too. It doesn't change my analysis, Osei said. What you did in that OR was correct. Why you were capable of it is a separate question, but the board is going to combine those questions whether we want them to or not. Yes, Sara said. I know. I'm going to let them. Another silence. Okay, Osei said. Do you want me at 3 o'clock? Sara thought about it. Yes, she said. Please. The Floor 7 conference room at Hartwell Memorial had a long table and windows that looked out over the parking structure and a quality of institutional gravity. that conference rooms develop when they've been used for enough difficult conversations. Board Chair Miriam Tate was at the head of the table. She was 63, white-haired, and had the precise, contained manner of someone who had been managing institutional crises long enough to have stopped being surprised by the specific forms they took. Voss sat on one side of the table with his attorney, a man named Garrett, who had the studied confidence of someone billing $400 an hour and wanting everyone present to understand that. Voss himself looked different than he had in the OR yesterday. He looked, Sara thought, like a man who'd spent the night reading his own name in places he hadn't anticipated it appearing. Sara sat across from him with Ose beside her and Reyes in a chair along the wall. Dina Okafor was there too, She'd been asked to provide her statement in person, and she sat at the far end of the table in her scrubs because she'd come directly from a shift, and she sat with the upright posture of someone who had made a decision and was not going to be moved from it. Miriam Tate opened without preamble. I want to be clear about the scope of this session. We are here to address a specific question: whether the operative incident report filed by Dr. Voss following the emergency procedure on December 9th accurately reflects the documented medical events of that procedure, as recorded by the automated anesthesia monitoring system. She looked around the table. We are not here to conduct a full disciplinary hearing. We are not here to adjudicate the question of Nurse Merritt's actions, which will be addressed separately. We are here to answer one question. Garrett leaned forward. Chair Tate, my client, Mr. Garrett, you will have time to speak. Her voice didn't rise. It didn't need to. Dr. Ose, you prepared a technical analysis of the anesthesia record. I'd like you to present it. Ose opened her folio. She was precise and unhurried. She walked through the timestamps in sequence, translating the automated monitoring data into plain language, narrating what the numbers showed. The patient's pressure at each interval, the rate of decline, the moment of critical threshold, the moment of stabilization, and what the timestamp on that stabilization meant in relation to the position of personnel in the room. She didn't editorialize. She didn't need to. The timestamps were a sequence, and the sequence told a story, and the story it told was not the story in Voss's report. When she finished, the room was quiet. Miriam Tate looked at Voss. Dr. Voss, in your incident report, you described the management of the patient's hemorrhagic decline as a continuous surgical response led by you. The anesthesia record shows a stabilization event occurring at a timestamp that, based on Dr. Ose's analysis, is inconsistent with the position of the primary surgeon at the operative field at that moment. She paused. Can you explain that inconsistency? Garrett put a hand on Voss's arm, a subtle restraint. Chair Tate, we believe the anesthesia record timestamps may reflect a calibration variance in the monitoring equipment that Mr. Garrett, Tate looked at him without expression. The monitoring equipment in OR2 was calibrated and certified 2 weeks ago. The calibration records are in this folder. She touched a folder in front of her. Do you want to continue that line of argument? Garrett closed his mouth. Voss looked at the table. Dr. Voss, Tate said again. The question stands. Voss looked up. He looked at Sara, and it was the first time he'd looked directly at her since she'd sat down. She met his gaze and held it without expression. She didn't need to say anything. She'd stopped needing to say anything to men like Voss a long time ago. The record said it now. The incident was complex, Voss said. His voice was controlled, but there was something underneath it that hadn't been there before. Something that sounded like a man who had run his options and found them shorter than expected. In a fast-moving emergency, precise attribution of surgical steps is, Dr. Voss, Tate cut him off. Not sharply, just cleanly. This board has reviewed your incident report against the anesthesia record and against 4 witness statements. We have also reviewed, and I am informing you of this now, a complaint received this morning from the Massachusetts Board of Registration in Medicine regarding an incident report you filed at a previous institution in 2019. She looked at him steadily. We will be addressing that matter in a separate session. For now, I'm asking you, on the record, to confirm or deny that your incident report for December 9th accurately reflects the events of that procedure. The room was very still. Garrett leaned in and said something in Voss's ear. Voss's jaw moved. He looked at the table again. Sara watched his hands, which were flat on the table and not moving. I may have, Voss said slowly, reconstructed certain elements of the sequence from memory in a way that did not fully account for the contribution of other personnel. It was not an admission, it was the shape of language that lawyers build when the truth is no longer avoidable, but the word falsified is still too close. Sara had seen men navigate exactly this architecture before, in different rooms, for different reasons. The architecture was always the same. Tate looked at him for a moment. "Thank you, Dr. Voss," she said. "Mr. Garrett, we'll be in contact with you regarding next steps. You're excused." Garrett gathered his things. Voss stood, and as he did, he looked once more at Sara. Not with the authority he'd had yesterday, not with the fury of a man issuing a termination. He looked at her with something that was quieter and worse, the specific expression of someone who understands too late that they have encountered a situation they cannot manage. He walked out. The door closed. Dad. Dina gave her statement in 18 minutes. Clear, direct, with the blunt credibility of someone who had spent 11 years in trauma nursing and had no investment in making anyone look good or bad, only in saying accurately what she'd seen. When she finished, Miriam Tate thanked her and she left, and on her way out she stopped beside Sara's chair and put one hand briefly on Sara's shoulder and didn't say anything, which was the right call. Then it was Sara's turn. Tate looked at her with an expression that was measured and not unkind. "Nurse Merritt, the board is aware that your situation is complicated. Before we discuss the events of December 9th, I want to ask you directly, is there relevant background information about your training and experience that was not disclosed in your original employment application?" Sara had thought about how to answer this during the drive back from Kinston. She turned it over from several directions and arrived at the same place each time. "Yes," she said. "My military service included specialized surgical training in emergency and combat medicine that exceeds what my civilian nursing license reflects. I did not disclose the full scope of that training when I applied to Hartwell Memorial. I made that choice deliberately because I wanted to work in a standard nursing capacity, and I believed the additional background was not relevant to that role." "Do you still believe that?" "I believe it was the wrong call," Sara said. "Not because of what happened yesterday. Because the board and the institution have a right to know what kind of experience their staff is carrying. I made a decision that prioritized my own preference for privacy over institutional transparency, and that was my error." Tate was quiet for a moment. She looked at the folder in front of her. "The board will need to address the question of the unauthorized procedure. You understand that?" "Yes?" "The emergency doctrine provides significant legal cover. The documented timeline supports the necessity of your intervention, but the scope of what you performed goes beyond what your license authorizes, and the board cannot simply set that aside." "I'm not asking you to set it aside," Sara said. "I'm asking you to consider it in full context. What I did, why I did it, what the outcome was, and what the alternative would have been." Tate looked at her steadily. "What would the alternative have been, Nurse Merritt, in your professional assessment?" Sara didn't hedge. "The patient would have died on that table," she said. "The right lateral bleed would have progressed to cardiac arrest within 4 to 6 minutes of the pressure drop I observed. Dr. Voss had not identified the source. The attending anesthesiologist was managing a declining patient with no primary surgical intervention targeting the correct location. The window for correction was closing." She paused. "I made a judgment call. I have made judgment calls in conditions that were considerably worse than that OR, with considerably less equipment. The judgment was correct. The patient is alive. I will not apologize for the judgment." "I'm not asking you to apologize," Tate said. "No," Sara said. "I know." There was a brief silence. "Your termination," Tate said. Dr. Voss filed it within the scope of his authority as trauma chief. The grounds he cited are technically correct, Sara said. He had the authority and the grounds. "I'm not contesting the termination." Osei beside her made a small controlled sound. "Patricia," Sara said, without looking at her. "You should contest it," Osei said directly to Tate. "The grounds exist, but the intent behind the filing is inseparable from what we've just established about Dr. Voss's incident report. He filed a termination and then falsified a record to support it. The termination cannot be evaluated in isolation from the falsification." Tate looked at Osei, then at Sara. "That is a point the board will need to consider separately," she said. "It will be part of the comprehensive review." She closed the folder. One more question, Nurse Merritt, and I'm asking this not as a procedural matter, but because I think it's important. She looked at Sara directly. Is there anyone else at this institution who has been affected by Dr. Voss's conduct in a manner that has not yet been documented? The room was quiet. Sara thought about the voice on the phone that morning. He has a pattern. The person it cost was also a woman. She thought about the way certain things accumulate in institutional environments, not dramatically, not with clear evidence, but in the accumulated small decisions of people who know something is wrong and have calculated that the cost of saying so is too high. I don't know, Sara said honestly, but I think if you ask the question in the right way, to the right people, you may find out. Tate nodded slowly. We will ask, she said. The session ended at 4:45. Sara walked out of the conference room into the 7th floor corridor and stood for a moment in the particular quiet of a space that had just held something significant and was now empty. Osei came out behind her and they walked toward the elevator without speaking. In the elevator, Osei said, You should have contested the termination. Let the board get there on their own, Sara said. If I fight it, it looks like self-interest. If they reverse it because the falsification made it indefensible, it's a different outcome. Osei looked at the elevator doors. That's very patient of you. I've been patient for 4 years, Sara said. I can manage another week. They stepped out into the lobby. Reyes was waiting near the entrance, coat on, the same economical stillness she'd had all day. She fell into step beside Sara without being asked. Outside the automatic doors, the Raleigh afternoon was gray and cold. There were 2 news vehicles in the parking lot that hadn't been there this morning. Camera equipment visible in one, a woman in a good coat doing a phone call beside the other. The article had done its work. The story was moving. Sara looked at the news vehicles and then looked away. She was thinking about the 3 patients in Kinston and whether the transfer she'd recommended had been initiated. She was thinking about the woman in Bay 3 and the blood pressure that had come back from somewhere it shouldn't have. She was thinking about small things, what she was going to eat, whether her apartment was cold because she'd left a window cracked that morning. Her phone buzzed. Webb. The board has suspended Voss's surgical privileges pending the full review, he said when she answered. Effective 1 hour ago. The Massachusetts board has been formally contacted. The hospital's legal team is reviewing the Boston settlement agreement. That was fast, Sara said. Tate moves fast when she decides to move, Webb said. I've known her for 12 years. Today she decided. A pause. The 3 individuals in Kinston are being transferred to a secure medical facility in Virginia within the hour. Your documentation traveled with them. The physician receiving them has been briefed. The woman, Sara said. She needs a surgical team within 6 hours. She'll have one within 4, Webb said. I've confirmed it. Sara exhaled slowly. Okay. There's something else. Webb's voice changed register slightly. Not dramatically, but enough that she caught it. The attorney who filed Voss's amended complaint this morning also sent a letter this afternoon to the state nursing board. Not the medical board, the nursing board. He paused. It's a formal petition requesting emergency suspension of your nursing license pending investigation of the unauthorized procedure. Sara stopped walking. Reyes, 2 steps ahead, stopped and turned. He's trying to get ahead of the board's reversal, Sara said. If the medical board moves against him and the hospital reverses the termination, he needs a parallel process running against me to claim mutual grievance. That's the read, yes. The nursing board has to act on the petition. They have to acknowledge it. Whether they act depends on how they weigh the emergency doctrine and the testimony on record. Webb paused again. There's a complication. Tell me. The letter Garrett sent to the nursing board includes a document that was not part of any proceeding today. It's a partial service record, incomplete, selectively redacted, that Garrett is characterizing as evidence of a pattern of unauthorized medical conduct during your military service. A pause. Sara, wherever he got this, it's not from a public source. Someone gave him access to a record that should not be accessible. Sara stood on the sidewalk outside Hartwell Memorial with the cold air on her face and a very specific kind of stillness moving through her. The categorized material, she said. The 2 years. I don't know what material it is yet. My people are reviewing it now, But the framing Garrett is using, Webb stopped, started again. He's not just trying to defend Voss. Someone has been building a file on you, before yesterday, before the OR. This didn't come together in 24 hours. Sara looked at the parking lot. The woman in the good coat had finished her call and was looking at her phone. The camera equipment was still in the vehicle. Ordinary afternoon. How long? Sara said. My best estimate, Webb said carefully, is that someone started building it approximately 6 weeks ago. 6 weeks ago. When Webb had told her he'd been looking for someone with a specific set of qualifications for 6 weeks. Before I came to your attention, Sara said. Yes, Webb said, which means someone else found you first. The word first sat in the air between Sara and the phone like something with weight. She processed it the way she'd been trained to process information that changed the shape of a situation. Not with panic, not with immediate action, but with the particular stillness of someone who needed 30 seconds to rebuild the map before they moved. Someone had found her 6 weeks ago. Before Webb. Before the OR. Before any of this. Which meant the collision in OR2 hadn't been random. Or rather, the highway accident had been random. Marcus Webb's injuries had been random. Her instinct to step into the field had been as involuntary as breathing. But someone had positioned themselves to be ready when something like that happened. Someone had been watching Sara Merritt and waiting for her to do something that could be used. Who had access to the categorized material, she said. That's what I'm trying to establish, Webb said. The partial record Garrett submitted. I've seen a description of it. It references operational details that were never in any file accessible through standard channels. Someone with either high-level clearance or a very specific connection to the unit reached into a place they shouldn't have been able to reach. And gave it to a hospital attorney in Raleigh, Sara said. Indirectly. There are at least 2 intermediaries between the source and Garrett. We're working backward. A pause. Sara, I need you to think about who might have had motivation to build a file on you 6 weeks ago, before I found you, before any of this was visible. She thought. 6 weeks ago, she had been a scrub nurse at Hartwell Memorial. She had not been in contact with anyone from her service life. She had not applied for any position that would have flagged her background. She had not done anything, in 6 weeks or 6 months, that should have made her visible to anyone who'd known her before Raleigh. Except, the position you were trying to fill, she said slowly. 6 weeks ago, you started looking for someone with a specific set of qualifications. You weren't the only one looking. Webb was quiet. Whatever the situation in Kinston was, the 3 people, the facility, the reason they needed someone with my particular background, you weren't the only party who knew that situation existed. She paused. Someone on the other side of that situation also needed to make sure the right person didn't reach them. Another quiet. Longer. That's a significant leap, Webb said, but his voice didn't have the shape of someone dismissing an idea. Is it wrong? The pause that followed was answer enough. We'll talk about this tomorrow, Webb said. Somewhere that isn't a phone. Another pause. Tonight. Go home. Don't talk to anyone you haven't already talked to. The nursing board petition will take at least 72 hours to process. Nothing is going to happen tonight. Sara looked at Reyes, who was standing 4 feet away with the patient expression of someone accustomed to waiting for information to finish traveling. Understood, Sara said. She hung up. Reyes raised an eyebrow, just slightly, the military equivalent of a full question. Someone built a file on me before any of this started, Sara said. Webb thinks it connects to Kinston. Reyes absorbed this without visible reaction. Do you believe him? I believe it's possible, Sara said. I also believe that the most immediate problem is a nursing board petition that Voss's attorney filed 2 hours ago using material that shouldn't exist, and that everything else, Kinston, the file, whoever built it, is a problem for tomorrow. Reyes nodded once. Then go home. Sara went home. She slept 4 hours, which was more than she'd expected. In the morning, she made coffee and sat at her kitchen table and wrote out, by hand on a legal pad, everything she knew in the sequence she knew it. Because writing things out in sequence was how she'd always thought most clearly, and old habits had their uses. When she finished, she looked at what she'd written and then set the pen down and called Ose. The nursing board petition, she said, when Osei answered. Garrett used a partial service record, selectively redacted, framing it as a pattern of unauthorized conduct. I know, Osei said. Webb's office sent me a summary at 6 this morning. A pause. Sara, the record they used, I need you to tell me if any of what it describes is accurate. In the sense that I performed medical procedures in environments where I was not the licensed physician present, Sara said. Yes, that's accurate. The framing of it as unauthorized it's not the right word for how that work operates, but I understand why Garrett used it. Can you explain how it actually operated? In a forward operating environment, the medical authority structure is not the same as a civilian hospital. The senior medical officer may be physically unavailable. You operate with the training you have and the materials you have and the protocol you've been given. The documentation afterward reflects the unit's framework, not a civilian licensing board's. She paused. None of what I did in that context was reckless or negligent. Every outcome is documented. I have a service record that reflects that, including commendations for 3 specific incidents. We need the full record, Osei said. The full record. The thing Sara had spent 4 years making sure nobody saw. She looked at her kitchen window. The morning was overcast, the light flat and gray, an ordinary November day with nothing particular to distinguish it. She thought about the photograph she'd left in her locker without looking at it, the one she'd come back for 2 days ago when the hospital had let her retrieve her belongings. She'd put it in the kitchen junk drawer without opening it. It was still there. I know, Sara said. You don't have to, Osei said. The emergency doctrine case is strong enough without it, but the petition is a separate track, and if Garrett gets to define your service record before the board sees the real one, the framing sticks. I know, Sara said again. She opened the junk drawer after the call ended and took out the photograph. It was small, 4 inches by 6, slightly bent at one corner. The image showed 7 people in a location that was dry and very bright, squinting against the sun, most of them in some combination of field gear and medical gear. She was second from the left. She looked younger and more tired than she remembered feeling. Osei was at the far right. She looked at the photograph for a long time. Then she called Webb and told him she was releasing the record. What followed was not a single dramatic moment. It was a week of processes, overlapping, unglamorous, occasionally contradictory, the kind of institutional reckoning that looks, from the inside, like an enormous amount of paperwork. The full service record was reviewed by the nursing board's investigative panel on a Thursday. Sara was present with Osei and a federal liaison that Webb's office had provided, a civilian attorney named Marcus Holt, who spoke very little but had the specific quality of someone whose silence cost money and therefore meant something. The panel had 3 members. They spent 4 hours with the record. They asked Sara 41 questions, which she answered without evasion, including the ones about the 2 categorized years that had been partially declassified for this purpose at Webb's request. By the end of the 4th hour, one of the panel members, a woman in her 60s named Dr. Ruth Saylor, who had the look of someone who had been doing this long enough to be bored by most things, put down her pen and said, "The petition submitted by Mr. Garrett alleges a pattern of conduct inconsistent with safe and authorized medical practice. Having reviewed the complete record, I would characterize what we've seen as the opposite. I would characterize it as one of the more comprehensive emergency medical backgrounds this panel has encountered in a professional conduct review." She looked at Sara. "The petition is going to be dismissed. I'm telling you that now so you don't spend the weekend not knowing." Sara looked at her. "Thank you." "Don't thank me," Saylor said with a brevity that Sara found unexpectedly steadying. "The board does not need gratitude. The board needs accurate information. You finally gave us some." It was not a clean absolution. Saylor was right that the petition would be dismissed, but the board also issued a formal notation in Sara's file acknowledging that her initial employment application at Hartwell Memorial had not disclosed the full scope of her medical training, a gap that, they noted, future employers were entitled to be aware of. It wasn't a sanction, it was a fact. Sara accepted it because it was a fact, and fighting it would have meant arguing that she'd been right to hide things, which she no longer believed. Voss's collapse was not quick, but it was thorough. The medical board's full investigation took 3 weeks. During that time, the Massachusetts board reopened the 2019 incident with the benefit of testimony from the nurse who had previously signed a non-disclosure agreement, a woman named Angela Ferris, who had, it turned out, been waiting for exactly this kind of opening without knowing it would come. The settlement agreement's non-disclosure clause was ruled unenforceable as a matter of public policy given the patient safety implications. Ferris's account of the Boston incident matched the structural pattern at Hartwell Memorial in a way that left no reasonable reading other than deliberate conduct. The incident report from December 9th was formally classified as a falsification of medical records. That finding triggered an automatic review of 3 other operative reports Voss had filed over the previous 18 months, 2 of which contained inconsistencies that the board characterized as strongly suggestive of retrospective modification. The language was careful. The conclusion was not. Voss surrendered his medical license on a Tuesday in January before the board could formally revoke it. His attorney framed this as a voluntary decision made in consideration of his health, which was the kind of statement that nobody believed and that Garrett had probably advised against but issued anyway because there was nothing better available. The hospital announced his departure in a 3-sentence press release that said nothing specific and thereby said everything. Sara read about it on her phone while she was eating lunch in a small restaurant near her apartment, a place she'd started going to after the hospital because it was quiet and the soup was good. She read the 3 sentences twice, set the phone face down on the table, and finished her soup. She didn't feel what she might have expected to feel. She had thought, during the preceding weeks, that when this moment came it would carry something cathartic, some clean release of the particular tension that had been sitting in her chest since the afternoon Voss had leveled his finger at her across the instrument table. What she actually felt was more complicated and less satisfying and probably more honest. Something tired, something relieved, and underneath both a quiet acknowledgement that the outcome was correct without being uncomplicated. He had lost his license. Angela Ferris in Boston had her story on the record. The falsified report was in the board's permanent file. Those were facts. They were the right facts. They did not undo the week she'd had, or the 4 days the woman in Bay 3 had spent in a detention facility getting sicker because no one with adequate training had been there. They did not change the structural conditions that had allowed Voss to function the way he had for long enough to accumulate a pattern. But they were what was available, and Sara had learned, over the course of a life that had not been soft, that you took the outcomes that were available and you didn't wait for the ones that weren't. The matter of who had built the file on Sara, who had found her 6 weeks before Webb, who had fed the partial service record to Garrett through 2 intermediaries, resolved in the way that these things often resolved, not with a clear confrontation or a dramatic reveal, but with a quiet federal finding that was never made public. Webb told her about it in person, in a federal building in Raleigh, in early February. The source had been a contractor with access to a federal database. The contractor had been hired, at one remove, by an organization that had an interest in the Kinston facility and specifically in ensuring that the 3 individuals there did not receive adequate medical care in time to provide testimony. The connection between that organization and Garrett had been indirect enough that Garrett himself may genuinely not have known the origin of the material he'd been given. The contractor was in custody, the investigation was ongoing and would remain ongoing for a period Webb declined to specify. "So someone tried to neutralize me before I was even relevant," Sara said. "They tried to neutralize anyone who might become relevant," Webb said. "You weren't specifically targeted at first. You were adjacent to something. Then you became specifically relevant because of what you did in OR2, and the material that already existed was deployed. And Voss was convenient." "Voss was genuinely aggrieved," Webb said. "That's the part that makes it complicated. He wasn't manufactured. His conduct was real. What the contractor did was identify a genuine pre-existing conflict and find a way to accelerate and weaponize it." He paused. "It's more common than you'd think." Sara looked out the window of the federal building at a parking lot that was entirely unremarkable. "The 3 in Kinston," she said. "They testified?" "The woman did," Webb said. "Last week, from a hospital in Virginia where she finished recovering." He paused. She asked me to pass something to you. I told her I would. He set a folded piece of paper on the table between them. Sara looked at it for a moment, then she picked it up and opened it. It was short. The handwriting was unsteady in the way of someone writing during physical recovery. It said, "I don't know your name. I know what you did. It was enough. Thank you." Sara folded it back up and put it in her coat pocket. She didn't say anything for a moment. Webb didn't push. "The woman I was," Sara said finally, "when I separated, she needed the quiet. She needed to be nobody for a while. I'm not apologizing for that. That was real." "I know," Webb said, "but 4 years is a long time to hide something that isn't actually dangerous." She looked at the table. "I hid it because I thought the past was something I had to manage. Keep it contained, keep it separate." She paused. "It turns out it was just part of me. And you can't manage yourself into pieces that don't talk to each other forever." Webb was quiet. "What is it you actually want to ask me?" Sara said. "You've been building to something for 10 minutes. He almost smiled, slightly. "The position I was trying to fill 6 weeks ago," he said. "It's still open. The situation in Kinston was part of a broader pattern. Facilities operating without adequate medical oversight, individuals in federal custody not receiving appropriate care. It's not a glamorous problem. It's a documentation problem and a standards problem, and sometimes when it gets critical, it's a you driving to Kinston problem." He paused. "I need someone who can move between the institutional and the operational, who understands both environments, who knows when to follow protocol and when protocol is the wrong tool." Sara looked at him. "You're asking me to go back." "I'm asking you to go forward," he said. "It's not the same work. It's not the same environment. You wouldn't be in the field. You'd be building something, a standards framework, an oversight structure, a set of protocols that the people in those facilities actually have to follow." He paused. "And yes, sometimes you'd have to go somewhere when it got critical. Would I have to hide what I am?" "No," Webb said simply. Sara sat with that for a moment. Outside, the February light was flat and cold over the parking lot. She thought about the soup restaurant near her apartment. She thought about the legal pad on her kitchen table and the photograph she'd finally taken out of the junk drawer and put on the windowsill. She thought about Ruth Saylor saying, "You finally gave us some," in that dry, unsentimental way, and how that had stayed with her. "I need 2 weeks," Sara said, "to tie up the remaining board matters and give Dina proper notice. She's going to have opinions about this." "She'll have opinions about everything," Webb said. "That's why she's good at what she does." 2 weeks, Sara said. 2 weeks, he agreed. Thought. Dina did have opinions. She expressed them in the break room of Hartwell Memorial on Sara's second-to-last day of a temporary consulting arrangement that the hospital had offered as part of the broader settlement of the termination question, not her job back, not exactly, but a formal acknowledgement that the termination had been improperly motivated, which was close enough and came with a payment Sara didn't argue about. Dina sat across from her with coffee she wasn't drinking and said, "You're leaving." "I'm leaving," Sara confirmed. "To do what?" Sara told her the outline. Not the classified details, just the shape. Oversight. Standards. The gap between what policy said should happen in certain kinds of facilities and what actually happened. Dina was quiet for a moment. "So you're going to spend your time making sure that the next person stuck somewhere without proper care doesn't end up like the people you drove to Kinston for?" "Essentially," Sara said, "and no one will know your name." "Some people will," Sara said. "The right people." She paused. "It's different from before. It's not the same kind of hiding." Dina looked at her coffee. "You know what bothers me most about all of this," she said. "Not Voss, not the file, not the board, not any of it." She looked up. "It's that you were here for 4 years. 4 years and I never asked you anything. I noticed things. I knew you were—" She gestured vaguely. "More than what the roster said, and I never asked." "I didn't want you to ask," Sara said. "I know." Dina set down the coffee. "That's also what bothers me." Sara didn't have a clean answer for that. She thought it was probably right, that there was something in Dina's not asking that was respect, and something in it that was the same institutional silence that allowed things like Voss to persist, and those two things were tangled together in a way that didn't resolve neatly. She wasn't going to pretend otherwise. "You're good at what you do," Sara said. "You've always been good at it. What you said to Price, on the record, with your name, that mattered. It was one of the things that actually mattered." Dina looked at her for a long moment. "Don't make it a compliment," she said. "It was just the truth." "Most important things are," Sara said. Marcus Webb was discharged on a Thursday in January. Sara knew this because Webb's office had kept her loosely informed of his progress, and because Marcus had asked, through his father, whether it would be okay if he sent her something. She had said yes. What arrived was a card, handwritten, on plain paper, in the slightly effortful script of a 19-year-old who didn't write by hand very often. It said that he was going back to his second semester in March. It said his lung was functioning at 94% capacity, and the physical therapist thought it would reach full function in time. It said that he'd told his roommate what happened, and his roommate had asked what the nurse was like, and he'd said he wasn't entirely sure how to describe her. "I told him you were busy," the card said. "He didn't get it." "I think I do." Sara read this at her kitchen table on a Sunday morning with coffee and the photograph on the windowsill where she could see it without having to look directly at it. She read it twice. Then she set it beside the photograph. She wasn't a person who collected things, as a rule, but some things had weight, and weight deserved a place to rest. What she understood in the end, not as a conclusion but as something she'd been arriving at for a long time, was that the life she'd tried to divide into before and after was never actually divided. The woman who had worked in dust and noise, and the particular specific pressure of having 10 minutes to do something that needed to be done, or someone died. That woman had not disappeared when Sara Merritt became a scrub nurse in Raleigh, North Carolina. She had just been quiet. She had been standing in the background of every shift, every procedure, every moment when Sara had assessed a situation faster than she should have been able to and made a call with more certainty than her license accounted for. She had spent 4 years thinking that compartmentalization was the same as healing. She'd been wrong about that, and the wrongness of it had cost her something she was still measuring. But it had also, in the specific and unplanned way that mistakes sometimes do, put her exactly where she needed to be on the day a 19-year-old bled out on a table and nobody moved. She had not saved Marcus Webb because she was exceptional. She had saved him because she had been paying attention to the monitor, to the field, to the small signs that told the real story before the obvious one became visible. She had done it with skills that the institution didn't know she had and didn't think she deserved, in a room where the person in authority had decided she didn't merit the basic courtesy of being heard. That was the part she kept returning to. Not the rescue. The room. The way the room had felt before she moved. The familiar weight of being the person who knows something and is not being asked. She had been in rooms like that before. She would be in rooms like that again. There was nothing about a title or a credential or a uniform that automatically changed the way a room felt. What changed it was deciding that you were going to speak anyway. Not because you were certain of the outcome, not because the cost was something you'd calculated and found acceptable, but because the alternative, staying silent while something preventable happened, was a cost you weren't willing to pay twice. She thought about Angela Ferris in Boston, who had signed an agreement and gone quiet, and waited 6 years for a room to open that she couldn't see coming. She thought about the people who had been in that Kinston facility and the medical staff who had done the best they could with what they had and then called for someone because they had the clarity to know the limits of what they had. She thought about Dina Okafor in the break room saying it was just the truth. Like that was a small thing. It wasn't a small thing. It was the only thing. The truth spoken out loud, in the right room, by someone willing to put their name on it. That was the mechanism. Not heroism, not exceptional capability, just a person who knew something and said it and didn't take it back when it got expensive. Sara had been that person once, in a different life, in conditions that most people would not have survived. She had thought she was done being that person. She had been wrong. She picked up her phone on a Monday morning in February and texted Webb one word, "Ready." His reply came back in 40 seconds. "Reyes will pick you up at 8. Sarah set the phone down on the kitchen table next to the card from Marcus Webb. She looked at the photograph on the windowsill. 7 people in bright, unforgiving light, squinting into whatever came next. She had spent 4 years being nobody. She had decided that was the safe choice. The safe choice had not held, which meant the only thing left was to be, without apology, exactly who she was. Someone who had seen the worst of what human bodies could endure and had learned to meet it with steady hands and clear eyes, and the particular kind of stubbornness that refuses to let a preventable thing happen when prevention is still possible. The woman they had tried to erase was not gone. She had never been gone. She had just been waiting for the room to need her.